Well, today for a Wellness Wednesday, we're focusing on the symptoms of long COVID in children, and there's a new program designed to help families. So joining me now is Dr. Laura Malone to discuss. Dr. Malone, it's so good to have you here live on Fox 5. Good morning.
Thanks for having me.
Absolutely. We were talking about the passage of time. It's now been 5 years since we were all struck with the COVID-19 pandemic. Where do things stand when it comes to long COVID signs and symptoms with children?
Yeah, so we're recognizing that long COVID can definitely occur in children, and symptoms can vary from child to child. Some of them are fairly similar to what is seen in individuals that are adults with long COVID. But some of the more common symptoms we see are things like fatigue, dizziness, brain fog. There can be mood changes and pain. Sometimes younger children can actually present with different symptoms, things like stomach pain or nausea, or they might just have behavioral changes. And so a lot of kids just say that they don't feel like themselves after a COVID-19 infection, since many of the symptoms can be relatively indolent or subtle and sometimes hard to describe. So it's really important to have awareness about this in order to check in with your children and make sure that they're doing okay.
Well, what are the treatment options? You know, once a parent or guardian realizes, okay, this is what it is, what are the next steps?
Yeah, so the first step is to reach out to your child's pediatrician or their primary care doctor. And so there are lots of ways that we can support children with long COVID, whether that may be medications, lifestyle treatments, or various accommodations to help them attend school and various activities that they want. And so if families are local to the Baltimore, Washington area, they can always reach out for an appointment with us at the Kennedy Krieger Institute. And both families and providers can refer patients, and we can provide a lot of support to help them get back to the activities that they want to be doing.
Finally, and this question just came to me, do you find that those who had the COVID vaccine fare better when it comes to long COVID, or is it pretty much the same whether you were vaccinated or not?
That is a great question. And so there have been some studies that show that vaccination with the COVID-19 vaccine can reduce your risk of developing long COVID, both in adults and children. You still can develop long COVID even if you've had the vaccine, but definitely the risk can be lower. So we do recommend that even for children to help reduce that risk.
Thank you so much, Dr. Laura Malone. We appreciate your time and information.